When you come in for a treatment, my first treatment sessions are an hour and a half. The half hour is spent in getting to know you, going through your medical history, and slowly and gently trying to unravel what may be causing the symptoms that have brought you in. Nobody ever comes in to see me because they're doing just fine. Everybody comes in because they have a problem. And usually that problem is pain of some sort. We work back through the pain symptoms and try to figure out what the core is. My specialty, or my forte, is in fact working on the digestive system. I find that is the one system in the body that is, first off, exposed to the outside world other than your skin. It is the one system in our body that we change what we put into it on a daily and sometimes throughout the day basis. And we don't always choose the right things to put into this system. As a result, the digestive system gets quite a workout. Something to keep in mind is that the lining of your colon, which is the large intestine, changes the membrane every 3 to 5 days. Now that's phenomenal compared to the rest of the body that does not change at that speed at all. If any of these things start to go wrong, then the symptoms will show up, and we are trained as osteopathic practitioners to actually see what the problem is. So after a half an hour of assessment, we then start to get into the treatment, and I will go through various types of tests, manual tests, to find out what's mechanically not working. I will also use my visceral manipulation skills to find out if the organs are in fact involved, and I'll also use my cranial osteopathy skills to see if in fact the cranial sacral system is out of balance. Once we've figured out, I have a general idea and a treatment plan, if you will, then we proceed in that first session with a treatment. Osteopathy is not long-term. I don't see people month after month after month. What we're trying to do is find the problem, the core lesion as we call it, work with that, allow the body to find the balance, and then to resolve and to heal itself. And then usually what we do is sit back after 3 or 4 treatments. You might even give it a month or 2 at that point, and then follow up with one last treatment, and generally that's usually the end of your osteopathic experience for that particular core lesion.